Toronto's most watched 5 o'clock newscast, CBC News Toronto at 5. To health news now, and a new study out tonight that suggests your risk of heart disease may depend on your ethnicity. The research looks at 4 of Canada's largest ethnic groups. So which one's most at risk? Kelly Crow can show you.
Cardiologist Dr. Chi-Ming knows that the ethnic background of his patients makes a difference. Yet most of his training has been based on research done mainly on white people.
With the studies that we have done, basically it's all done mainly among the white population. And we have been actually practicing medicine thinking that, we are all created the same. But in fact, we are not.
Now a new study suggests that ethnic groups have different health risks. Published today in the Canadian Medical Association Journal, the study compared the risk of heart disease and stroke among 4 of Canada's major ethnic groups. When the researchers crunched the numbers, study author Maria Chu was amazed by what they found.
We found striking differences in their cardiovascular risk profiles, particularly risk factors such as smoking, diabetes, obesity, as well as physical inactivity in these populations.
When they compared whites, South Asians, blacks, and Chinese Canadians, they discovered smoking, obesity, and stress were significantly more common in whites. Overall, Chinese had the lowest risk of heart disease and stroke. South Asians had risk factors in the middle range, yet had the highest prevalence of heart disease and stroke. And researchers found what they called a black paradox. Black Canadians have high risk factors, but low prevalence of disease.
Now, it's very hard to know whether this is nature or nurture, whether it's genetically driven, or it's actually our lifestyle that are different among different ethnic groups.
Even if the differences are genetic, the researchers say risky behaviors like smoking and obesity can be changed.
The good news of this story is that these are modifiable risk factors.
The study's authors suggest doctors should pay closer attention to the ethnic background of their patients, looking for risk factors particular to that group, so they can watch for warning signs of heart disease and stroke before they turn into serious health problems. Kelly Crow, CBC News, Toronto.